Hello, dear nursing aspirants. Welcome you all to the Master Nursing classes. So, as all of you know that in our Telegram group, we have announced that there will be a classes for the upcoming RRB and NORCET 8 exams. So, I am here to discuss the very important topics for the our upcoming RRB and NORCET 8 exams, as I have announced in the Telegram group. So, be connected with these very important topics concept till the classes will end. So these classes will run till your RRB exams. So in this particular concept, you have to revise those very important concepts from the each and every subject. So the classes will be not rises from the four questions from community, two questions from medicine, one question from psychiatry. No, it's not like that. It is the complete conceptual revision classes. So that may completely with same options with same question body may strikes in your upcoming exams. It's a assurance from my side. Okay, so don't run behind those type of the concept that you are discussing this one and leaving that and discussing that one. So yes, you have to know that your concept and your subject should cover whenever you will be watch classes. Okay, so my approach is that we will discuss those very important 100 to 120 concepts that will definitely strikes in your exam in each and every question, students. So in every exams there are around 60 to 70 questions will be like that. It will be coming from the those very and very important topics. So we will cover those very and very important topics here. So that will definitely helps you for your upcoming exams. Okay, many times you are giving exams and you are coming to the home. You will be, yes, I know that, I know that I have studied it, but I have masked it wrong. Students, it is not like that. So while studying, you have to study with proper knowledge, proper concept. Okay, so that is very much helpful for you all for your upcoming exams. Okay, so we will discuss those very important topics here. Okay, be connected with the master nursing classes till the classes runs here. So it will be very helpful for your striking the marks in our upcoming exams. Okay, so here is the yes first question in front of you all. So read the question perfectly, carefully. Very easy questions, students. It is a mainly repeatedly thousand time asked question in our exams. Okay, so yes, what is the question here? Yes, what is the most common cause to organism for the vaginal candidiasis? What is the most common cause to organism for the vaginal candidiasis? Yes, I am waiting for your answer in the comment box. Who all are live for the video, so do comment for the questions. As of yes, do comment for the questions. As I will see and respond your answer here. So, okay. Yes, is this equal? So if I ask the question, what is the most common cause to organism for the yes urinary tract infections, your answer would be equal. Students, if I ask the questions that what is the most common cause to organism for the yes pelvic inflammatory diseases in menopause woman, so your answer would be yes equal. So most common cause to organism for the pelvic inflammatory diseases in menopause woman is the yes, that is the E. coli. So most common cause to organism for the urinary tract infection is the E. coli. So here the answer is the not E. coli. So I am striking this one as a wrong. Yes, yes. The option next, option B is the yes lactobacillus acidophilus. So what is the another name of the lactobacillus acidophilus? Students, I have taught you already this question. Yes. What is the another name of the lactobacillus acidophilus? Yes. Can anyone answer? I am watching your answer here. What is the another name of the lactobacillus acidophilus? As I already told you. So this bacteria is very much helpful for the maintaining the pH in the vagina. Yes, very important, students. Yes, very good, very good. That is the daughterline bacilli. What is that? Daughterline bacilli, students. So this daughterline bacilli is a normal vaginal flora. Okay, so that will helps for maintaining the yes as acid pH of the our vagina. Okay, so is that clear? Yes, students. So option C stands here as the Candida albicans. Okay. So Candida albicans is a very important concept, students. So in each and every exams, it will strike. There is no any nursing competitive exams without Candida albicans. Yes. So in each and every exams, the questions will come from the Candida albicans. Candida albicans is a very important concept here, students. So what it is? It is in the yes basically fungus. Okay, it infection increases, the infection of this fungus increases when our body immunity decreases, so the infection will increases. So which infection very much necessarily that is the Candida albicans infections. The questions asking style may be vary in the exams, but the questions will definitely strike. Like what other kind of the questions they can ask in the candid albicans is very simple, students. A patient of the asthma who is taking the inhalational steroids, okay, through the metered dose inhaler. So, what is the important education as a nursing officer? You have to educate to that person. The question may ask in like this way. So, we have to educate that person to repeatedly wash the mouth after using the candida albicans and repeatedly inspect the mouth for the fungal infection. Why? Because students, in asthma, we will recommend the steroids for the reducing the inflammations in the our respiratory tract. So those steroids may deposit in the mouth and it will decrease the immunity. As I told, where there is a steroid use, there is a decrease in the immunity. And I told also that where there will be decreased immunity and increased chance of the candida albicans functions. Yes, so the style of the questions may different, but the concept is again same. Wherever the immunity decreases, there the candida albicans infection will increases. So, what all are the common site where the candida albicans can infection? Yes, where there is a wet area like oral cavity and vaginal cavity, and where are there is a body folds like axilla, groin, and yes, in the females. So below the breast folds. Okay, so these are the most common site where the candida albicans infection occurs. So how we can find this is candida albicans infection? Students, whenever there will be a candida albicans infections, there are white color rashes. Okay, so the rashes which bleeds come with the touch, and the rashes, if you push the rashes, so it will not vanish as easily. If you are pushing, you are scratching the rash, it is not going, and the rashes which is painful, and the rashes, yes, which bleeds if you push more strongly, so that kind of the rashes, the white color rashes are the candida albicans rashes. The white rashes after using the steroids in the mouth, that is because of the candida albicans. Yes, the white color discharge from the vagina with a severe itching. Okay, so after using any kind of the steroids, so that is again the candida albicans infection. Students, the candida albicans infection style of the questions I have explained, but the questions will come definitely, students. Okay, so yes, the most common cause to organism for the candida vaginal candidiasis is the candida albicans. Okay, yes, is the question is clear here. Very nice of you, LS, who all are given the option C as a correct answer. Your answer is correct. And what all are the other questions we have learned in this question? What is the most common cause of the urinary tract infection? That is the E. coli. What is the most common cause of the pelvic inflammatory diseases in menopause women? That is the again E. coli. Yes. What is the bacteria which maintains the normal vaginal flora as acidic? That is the Lactobacillus acidophilus or the daughterline bacillus. Both are same. Okay. Yes. What is the another question we have learned here? Where are the immunity decreases? There are the fungal infection increases, and all possible questions with asthma. I have explained that while using the inhalational steroid, the mouth oral cavity, the immunity will decreases, and there is chance of the oral candidiasis in the person who is taking the inhalational steroid. Okay, so that one also I have explained, and yes, very importantly, what is the nursing intervention also I explained along with that one. Okay, so these are the possible few questions we have learned from the one questions. Yes, here is the next question. Read the question carefully and give the best answer. Yes, very simple question, students. Yes, which sexually transmitted infection are commonly associated with the pelvic inflammatory disease? So now first tell me that what is pelvic inflammatory diseases and what are the parts which are included in the pelvic inflammatory diseases? Is this vaginitis and cervicitis are a part of the pelvic inflammatory diseases? So I want to answer in the form of the yes or no. Students, I am asking that vaginitis and cervicitis, is that both these infections are a part of the pelvic inflammatory diseases? I want your answer, students, in comment box. As I already told you all people, yes, should be completely interactive session. Very good, very nice of you all. Yes, so you can understand the what all are the pelvic inflammatory diseases in easy way. Okay, I will teach near 15 questions from this one image. You will be remembering for your lifetime. Okay, so don't forget this one. Pelvic inflammatory diseases, not including the vaginitis and cervicitis. So what all are the infections which will come under pelvic inflammatory diseases, sir? Listen now. So this is our dome-shaped fundus of the uterus. Yes. From here we are having the fallopian tube. Okay. So as all of you know that the female is having the two fallopian tube. Okay. So one is right side, one is left side. So this is the very important body of the cervix. Yes, this is the body of the uterus, and this is the part of the cervix. Okay, this is the internal os, external os, isthmus, and this is the our body of the uterus. Yes, is that clear? And here we are having the yes vagina. This is introitus. Okay, so this is fallopian tube. As all of you know that one fimbria is very long. That is called as in the yes ovarian fimbria, and same this side also. And here having the yes here we are having the ovaries. Ovaries are also two in number. Okay, very simple, students. So my question is now, what is the term we use for the infection and inflammation of the ovary? Can anyone tell the term we are using to tell that the ovary is infected or the ovaries get inflamed? Yes, yes, students, that is very important. That is the oophorytis. Okay, infection and inflammation of the ovary we call that is then the oophorytis. And what is yes infection and inflammation of the fallopian tube? Can anyone tell? Yes, can anyone tell what is the infection and inflammation of the fallopian tube? Yes, very nice of you all. This is what we call as in the salpingitis. What we call this infection and inflammation of the fallopian tube, that is the salpingitis. Okay, so infection and inflammation of the our yes uterus is called as yes. Can anyone tell what is the infection and inflammation of the uterus is known as? Yes, metritis. Okay, so we can say if the infection inflammation of the superficial layer, that is the endometritis. Okay, myometritis, perimetritis, we can say. Yes, endometriosis is another condition, students. That is because of the hormonal changes. Okay, so endometriosis is the yes. If this endometrium, it should be only present in the inside the uterine cavity. If this endometrium by mistakenly if it is comes over the ovary, so we call this one as in the endometriosis. Means the ectopic presence of the endometrium that will be outside the ovary uterine cavity. So that should be outside the uterine cavity. That is what we call as an endometriosis. Okay, not itis. Yes, is that clear? Yes. So endometritis is also a part of the pelvic inflammatory diseases. Yes, and this vaginitis and the cervicitis. These two are not considered as a part of the pelvic inflammatory diseases, students. Only salpingitis, yes, oophorytis, salpingitis, and endometriosis are called as the yes, our pelvic inflammatory diseases. And sometimes in some book they have given that is the peritonitis is also part of the pelvic inflammatory diseases if the infection is related to the pelvic related peritoneum only. Okay, is that clear? Clear. Okay, so what are the questions we have studied here? Yes, the infection inflammation of the ovary is called as the oophorytis. Infection inflammation of the yes our salpingitis, what we call as the salpings or the fallopian tube, that is also called as the salpingitis. Yes, infection inflammation of the ovary uterine cavity. Yes, that is what we call as in the yes endometritis. And what is the endometriosis also we have studied. And what is the cervicitis vaginitis? Okay, so also that one we have studied. And the cervicitis and vaginitis are the not a part of the pelvic inflammatory disease. Hope the concept is clear. Yes, yes. So which sexually transmitted infections are commonly associated with the pelvic inflammatory diseases? Option A is the syphilis and gonorrhea. Option B is the genital herpes and genital warts. Option C is the chlamydia and genital warts. Option D is the gonorrhea and chlamydia. Yes, who will tell the answer for this question? Who will tell the answer for this question? Can anyone tell the answer for this question? So as I told that in the previous question only, is the most common cause of the PID in menopause is the equalizer. But the question they have not asked in the menopause, so why we have to answer the menopause here? So E. coli not there in the option also. Yes. So then what is the most common cause we can say for the sexually transmitted diseases? What is the most common cause to organism? Commonly associated cause to organism. Which one? Yes. So the answer goes here as the option D. That is the gonorrhea and chlamydia. Students, if the question comes like this, what is the most common cause to organism for PID? That is the answer goes to the chlamydia trichomatis is the most common cause to organism for the pelvic inflammatory diseases. If some twist come in the questions like this, what is the most common acute cause of pelvic inflammatory diseases? What is the most common cause of the acute PID? That is the answer goes as the Neisseria gonorrhea. Yes. So the most common acute cause of the PID is the Neisseria gonorrhea, and the most common cause of the PID is the chlamydia trichomatis. So this is the answer here. Is that clear? Yes. Yes. Very nice of you all. Yes. I'm going to the next question. Here is the question in front of you. Read the question carefully. Then try to answer for this question. Yes, the National Family Planning Program started on dash. When our National Family Planning Program was started. Yes, option A 1952, option B 1977, option C 1999, option D yes 2014. Can anyone tell the answer for this question? It's very nice of you all. Yes, option A, that is the 1952 is the year when our National Family Planning Program was started. Okay, so student, India, the Bharat is the first country to adopt for the National Family Planning Program. So before that, no country in the world they have adopted the family planning programs. So India is the only country first time they have adopted the family planning programs in order to control the populations of the India. So here they have introduced the contraceptives. Then my question is the what is contraceptives? Contraceptives are the any kind of the devices or the instruments or the techniques where we are using that one to reduce the number of the childrens. That is we call as the contraceptives. Okay, so not only reducing the number of the children, the contraceptives we can use for the better spacing. So what is spacing? Spacing is the yes the gap between the two children students. That is what we call as the spacings. For spacings we can use temporary methods of the contraceptives, and for the reducing the number of the children we can use the permanent method of the contraceptives. It is very basics you have to understand. Yes. So the first question is the which country started the family planning program as a first? That is the India. And when was the first national family planning program was started? That is 1952. Okay. So here they introduced the contraceptives. Okay. So very important and very necessary. We have to know. Then, sir, we have studied that National Family Welfare Program. What it means, sir? Arey bachcho, it is nothing. It is nothing. Only National Family Planning Program. They have renamed as a National Family Welfare Program because this planning program, which sounds like odd word. Okay, and there is some big story behind this one to change the name of this program. So I will tell. When I have separate times for that one. Okay, so now we have the less time for our upcoming RRB and NORCET exams, so we have to quickly revise that one. Okay, so just we have to understand, yes, the National Family Planning Program started on 1952, and yes, it is renamed as a National Family Welfare Program on yes 1977. Okay, so National Family Welfare Program was started on the 1977, and National Family Planning Program was started on the yes that is on 1952. Is that clear, all of you? Yes, yes, very nice of you all. Okay, so here is the next question. Make this question as in the 10 star point. Okay, make this question as in the 10-star question for you all. Yes, yes, the usual dosage schedule for the scent chromen is. और ये क्या लेके आए आप? ಇದೇನ್ ತಗೊಂಬಂದಿರಿ ಸೆಂಟ್ ಕ್ರೊಮೇನ್ ಅಂತ ಕೇಳ್ಬೋದು. ಸೆಂಟ್ ಕ್ರೊಮೇನ್, yes, this is recently added in our yes, national family welfare program. So in this one recently added, that is the our scent chromen. So this scent chromen also we called as in the chaya, or we also call this one as in the sahali. Okay, so yes, so I am asking the doses dosage of the centromine. Fadafat do comment who all are live for this session. Yes, if you know the answer, do comment for the question. Fadafat. Very nice of you all. Option A is telling that the one tablet for every day. Option B is telling that the one tablet weekly. Option C is telling that the one tablet twice a week for the first 3 months, then once a week. Then option D is telling that the one tablet monthly. C. Very nice of you all. Yes, the option C is the correct answer. So centrochromin, also we call it as a chaya. So is the tablet. Yes, one tablet twice a week we have to give for the first 3 months. First 3 months we have to give that twice a week. Then once a week. Yes, students. So it is very important to understand the schedule of the chaya. Yes, consider this one as in the complete duration of the chaya. Okay, so first initial 3 months. Okay, so consider this one as in the 1 week, another 1 week, then another 1 week. Like you consider this one. So yes, in the first 3 months, in 1 week we have to do the two times, twice a week. Okay, yes, then twice a week, twice a week, twice a week. After the 3 months rest all period. So till the female wants to continue the contraceptive, so she have to take just once a week, once a week, yes, once a week. Yes, she have to take once a week. That's it. Is that clear? So this is the schedule for the our centrochromin. Hope the concept is clear for you all. First 3 months, twice a week we have to advise. Then yes, after that once a week we have to advise after the 3 months. Is that clear? Clear, students? Very nice of you all. Yes, option C is the correct answer for this question. Here is the next question. Which of the following is not considered as a natural family planning method? So among given options, which one is will not consider as a natural family planning method? Okay. So which of the following is not considered as a natural family planning method? Option A is the yes condoms. Option B is the symptothermal methods. Option C is the calendar method, and option D is the cervical mucus method. Which one we will not consider as a natural family planning method? Okay. So the word natural helps you all to get the answer by method of the elimination. Yes, students, natural means we are not using anything. We are not using a rubber. We are not using any condoms. We are not using any kind of the like tampons, today's sponge, diaphragm. Okay, IUCD. We are nothing. We are using naturally. How naturally? By knowing that when there is a time of the ovulation. Okay, when it is a better time or safe time to do the sex, and it is not a better time or safe time to not to do the sex. So by having the knowledge, we are avoiding the pregnancy. That is what we call as in the natural family planning method. But in the option A, that is the condoms, where we are using some artificially created thing, means it is not a natural. Okay, yes, in option question also they have asked which is not considered as a natural family planning method. That is the yes, condom is not considered as a natural family planning method. Yes, then what about symptothermal method, sir? Here the word sympto, then thermal. So there are two words. In the symptothermal methods, we are having the two types of the natural uh, methods of the family planning. So one is the yes, very basically that is the basal body temperature method. Okay. Then another one is the yes, cervical mucus method. Yes. So these two are the very basic symptothermal methods of the family planning. So that will helps to identify whether the woman ovulated or not ovulated. Okay, so based on the changes in the body temperature, that is what we call as in the basal body temperature method, and based on the yes the consistency and the characteristics of the cervical mucosa. So these two helps us to know that whether the female is ovulated or not ovulated. Okay, so this is called as the symptothermal method. I will discuss this basal body temperature method and cervical mucus method in the next question only, not in the next class, students. Okay, in the next question only you have to yes listen that one carefully in that one. Okay, so then calendar method is also natural method. Okay, so calendar method is the very basic natural method, students. Yes, so what is the calendar method? Yes, calendar method is the very simple method. Yes, this is only useful in the female with a regular menstrual cycle. Consider on the day 14th. On the day 14th, female is getting the yes ovulation, means 1 week before ovulation and 1 week after ovulation. So this time, particular this time period is the not safe for the sexual intercourse. Okay, not safe. Yes, and the rest of this one. Okay, rest of this period is very much safeful for the yes sexual intercourse time. So in this green highlighted area, yes, that is the time 1 week before ovulation or after ovulation the female underwent the intercourse, means there is highest chance of the yes getting the pregnancy. And other than this time, okay, so there is yes this red highlighted area. Okay, this red highlighted area, yes, in this time if the female went for the sexual intercourse, means there is very less chance for the yes happening of the yes pregnancy. Okay, so it is very basic method. Okay, that is the calendar method. Okay, so for calendar method we also called as the rhythmic method. Okay, so rhythmic method also we call. Okay, yes, it is very basic. Then cervical mucus method is also part of the symptomothermic method, so we'll discuss in the next question. Okay, so hope the answer for this question is very clear. Yes, here is the next question. Which of the following is the brand name of the scent chromen in India? Recently asked question in the yes NORCET only. Yes, what is the another name of the scent chromen? What is the another name of the scent chromen? And the question on the scent chromen they have asked in your ASSC exams also, students. Can you remember that? Which is the contraceptive, which is non-steroidal, okay, and anti-estrogenic, which acts with the help of the hormonoxapine. Yes, can you anyone heard the questions in your ESSC nursing officer exam? That is a non-steroidal anti-estrogenic. Yes, that is the scent chromen only. Yes, yeah. What is the another name of the scent chromen? Yes, that is the Sahel is the another name of the scent chromen, and for the scent chromen we also called as the Chaya. What you call? Chaya is also another name of the scent chromen. Yes, this is only recently added in our yes National Family Welfare Program, or we can say the National Family yes planning program. So in that one, this is the newly added one. Okay, so is that clear one? Yes. So here is the next question. I am repeatedly asking questions on the scent chromen, means this is very important. Okay, updated, so it will comes in your exams. So one more questions on the yes scent chromen. So what is the chemical name of the scent chromen? Here is the brand name of the scent chromen we have studied, and this one is the chemical name of the scent chromen. So which chemical it will be there in the scent chromen? Option A, levonorgestrel. Option B, that is the ethyl estradiol. Option C, that is the ormeloxifene. Option D, that is the mifepristone. Can anyone able to answer for this question? Yes, very nice of you all. Shabash. Yes, so all are giving the ormeloxifene as the correct answer. That is the correct answer. So all are giving the other options other than the ormeloxifene. So listen for the yes explanation. So mifepristone. So this is the mifepristone is the anti-progesterone agent, so it decreases the effect of the progesterone, so where we can use for the medical termination of the pregnancy. Okay, so in order to expel the product of conception out, okay, by reducing the yes the effect of the progesterone. So this is not included in the any kind of the our national family planning program contraceptives. Okay, so then ethylene estradiol is the yes the estrogen form that will be available in the our contraceptives. Okay, then levonorgestrel is the also we can say this one is in the LNG. Okay, levonorgestrel. Yes, LNG 20 is the chemical name of the yes our. Can anyone able to tell? Hormonal IUCD, that is which one? Well, very done. Well done. Well done. Well done. Well done. That is the LNG 20 is the IUCD. Yes, that is the another name of the our hormonal IUCD contraceptive, that is the Marano. Okay, so yes, in the Marano, what is the chemical form? Progesterone it will be there. That is the our levonorgestrel 20 is the chemical which is present in our hormonal IUCD. Okay, hormonal IUCD are the which generation IUCD students? That is the third generation IUCD. That is our hormonal IUCD. Is that clear? Clear? Yes. So ormoxafen is the chemical of the centrochromen. Chemical name of the centrochromen. Remember. So again, consider this one as a 10-star question for your RRB exams. Okay. So here is the next question. So what is the most common cause for the bacterial vaginosis? So you will be repeatedly getting the questions in your NORCET exams like, so this age female, she comes to OPD with severe vaginal itching and this many like green color discharge, like white color discharge with itching, without itching. Okay, so there is a question body that repeatedly coming in our questions. The questions on the bacterial vaginosis in 2021 question paper also it was there. NORCET, NORCET 5 also it was there. NORCET 4 also it was there. Okay, and recently in NORCET 7 also it was there, and NORCET 6 also it was there. So the question on the bacterial vaginosis. Okay, not only bacterial vaginosis, means the questions on the vaginitis. In the bacterial vaginitis, we are studying that especially on the as the Gardnerella mobilincus. Okay, this is a part of the vaginitis. In the vaginitis, we will study mainly that vaginal trichomoniasis, then vaginal candidiasis, then bacterial vaginosis. The vaginal trichomoniasis is the protozoal vaginal infection. Bacterial vaginosis is the bacterial vaginal infection, and fungal vaginal infection. That is the yes vaginal candidiasis we have seen in the first question itself. So the questions repeatedly striking in the exams means we have to know that what is actually uh, happening in the exams. Means students recently we have seen that by using that external feminine hygiene objects. So there are a lot of the cases which are coming with the yes our urinary tract infections and our yes the vaginitis and the pelvic inflammatory diseases as well. So because of that, there because of the sudden rise in the census, the questions will be asking repeatedly hugely in the NORCET. Okay, so not only in the NORCET, foreign medical services examination also question was there. Okay, so in the NEET PG also question was there. Yes, the question is repeatedly asking on the vaginitis, so it is very important to discuss the vaginitis in details. Okay, so yes, again I am assuring that in NORCET 8 also definitely one questions will strike from the vaginitis. Okay, so I will make all kind of the scenarios for these questions and I will throw in front of you. So it is up to you whether you have to catch or you have to not to catch. If you want to get the good ranks in the exams, catch my bullet points. Okay, so it is very important. So what is the most common cause of the bacterial vaginosis? I hope the answer clear for you all. Yes, that is the very nice of you all. Gardnerella vaginalis. Okay, so this is the yes, this is the bacteria. Yes, so also we have to say Gardnerella vaginalis as the Gardnerella mobilincus. Gardnerella mobilincus. So also the examiner can give this name in the exams. Okay, remember. So Gardnerella mobilincus and Gardnerella vaginalis are the cause organism for the bacterial vaginosis. So this is the one very basic questions. If the female comes with the bacterial vaginosis, what kind of the scenarios they can make? Students, remember that whenever there will be infection with the Gardnerella vaginalis, or we can say Gardnerella mobilincus, this particular bacteria replaces the female vaginal normal bacterial flora. That is what we call as in the yes, Lactobacillus acidophilus or the Dorsaline bacilli. It replaces the Dorsaline bacilli. Okay, means the Dorsaline bacilli goes vanishes, and this Gardnerella mobilincus keeps growing that area. I told you that the Gardnerella vaginalis, or we can say mobilincus, which replaces the our normal bacterial vaginal flora. That is what we call as in the Lactobacillus acidophilus. Means the Lactobacillus acidophilus is responsible for the maintaining the pH of the vagina. I told. So if that Lactobacillus acidophilus goes away, means the pH of the vagina will increases from acidity to alkaline in nature. Okay. So what I told is the what is normal vaginal pH. Normal vaginal pH is 4.5 is the normal vaginal pH, or we can say 5 to 4 to 5 is the normal vaginal pH. If the pH goes more than 5, there may be some clue in our exams that is the decreased in the our borderline basin because of by replacing the Gardnerella mobilicus. One clue they can give in the exams. Another clue is that there will be a clear whitish dirty discharges from the vagina, okay, which fishy in the smell, okay, and along with that, in the bacterial vaginosis, the infection name itself telling that students it is vaginosis means there is no vaginitis, means there is no itis means there is no inflammation, there is no inflammation means there is no itching. So without itching pH increased, without itching the dirty white color discharge which is coming from the vagina, so we can think that the patient is having the yes bacterial vaginosis. So it is very important students, yes, so you have to understand the concept. Yes, with intense itching, they if they give in the questions means easily you can eliminate the bacterial vaginosis. It is not bacterial vaginosis. If minor itching also, it is not bacterial vaginosis. Consider. So yes, the color of the discharge is white discharge. As the pH which increases and without itching, and as the fishy odor from the discharge which is coming from the vagina. So this directs us to yes go to the answer for the bacterial vaginosis. Is that clear? Clear. So hope the concept is clear for this one. And trichomonas vaginalis. This is causes the trichomonia vaginitis. Okay. So it causes the trichomonia vaginitis. So vaginitis means the patient will come with the intense itching. Okay. They can say the pruritus at the genitalia means the intense itching at the genitalia. Then the color of the discharge with the trichomonas vaginitis is the very simple, that is the greenish yellow color. The greenish yellow color discharge it will comes in the trichomonas vaginalis. Okay, so that will be caused by the this is the causative organism which causes the trichomonia vaginitis. Okay, so in the questions, there is intense itching and greenish and yellow color discharge means you close your eyes and put the answer as a trichomonas vaginalis, and the candida albicans also told that is the white discharge. White discharge. Sir, just 2 minutes before in the Gardnerella mobilincus or the bacterial vaginosis you told the white discharge. Again here also you are telling the white discharge, sir. How can we differentiate in the exam, sir? It is very basic and important, students. As I told you that in the bacterial vaginosis, there is no itching, but white discharge will be there. So this is the differentiating feature. It will direct you people to give the correct answer. In the questions, there is white color discharge. Let the discharge white, curdy, or the clear white, or whatever it may be. White color discharge with intense itching it will comes means you can put the answer as a candida albicans. White discharge without itching it will comes means that is the your answer would be bacterial vaginosis. Okay, and intense itching with greenish yellow color discharge, that is your trichomonia vaginitis, which is caused by the trichomonas vaginalis. Hope the concept is clear here. Yes, very nice of you all. So the answer for this question is the Gardnerella vaginalis. Here is the next question. Yes. So the basal body temperature method relies on which of the following? Yes. So option A is the changes in the cervical mucosa. Students, changes in the cervical mucosa is the this is also natural or family planning method, but it will not comes under basal body temperature. Then what is the daily measurement of the body temperature? Is this matter for the basal body temperature? Yes, it is very much matter, students. Okay, so what is the basal body temperature? So I will take a new slide and I will explain you nicely so that you people can understand better, students. So consider this is a complete cycle from day 1 to the day 28 of the female, okay, menstrual cycle. So yes, on day 14 or the half of the cycle, so she will get ovulate. Okay, so she will get ovulate. So in the first half of the menstrual cycle, the abundant hormone, you all of you know that is the estrogen. Okay, so in the second half of the menstrual cycle, the abundant hormone, you know that is the progesterone. Okay, that is the progesterone. In the presence of the estrogen, yes, the cervical mucus become watery, thin, and abundant. Okay, so how can I remember, sir, this one? Yes, we can remember this. It will be watery. So estrogen, this is the E, and make this one as the watery. Means water means it is the estrogen. W E W. You can remember. Yes, is that clear? Is it helps? Yes. So yes, it is water means it will be thin. Of course, it is water means water will be abundant only, and in the presence of the progesterone, so the cervical mucosa become thick, scanty. Opposite of this one you have to write. Scanty means very less, and that is thick in nature. Okay, so thick, scanty, and less. As I told students, on the day 14th, yes, that is the it is the time of the ovulation. Okay, so before ovulation, the cervical mucus become water, thick, and abundant, and after ovulation, that the cervical mucus become thick, scanty, and less. So by looking at the cervical mucosa, we can say that the female is ovulated or not ovulated. If the female is ovulated, means this period is not safe for the sex. If the female is not ovulated, means this period is safe for the sex, means the male can or the female can have the sex here. Okay, so she will not get pregnant. If the female get have the sex this side, so she will get the pregnancy. So is that clear? It is very simple. So by watching which one we are telling that the female will get pregnant or not pregnant by watching the cervical, yes, mucus. So this is what we call as the cervical mucus method. Similarly, students, in the second half of the cycle, yes, in the presence of the progesterone, in the presence of the, sorry, yes, in the presence of the our progesterone, let me change the pen color here. In the presence of the progesterone, yes, the body temperature will increase, students. Body temperature will increase by 0.5 to 0.8 degree Fahrenheit. Okay, remember students, it is degree Fahrenheit. So we have to advise the female that to monitor the body temperature before waking from the bed. So that is what we call as in the basal body temperature. Basal here means when the our entire body is at rest at that time. So she should take the temperature. So that is helpful for whether the temperature will increases or not increases. Students, what happens in village sites? So the female she will wake up early in the morning. Okay, she used to do all work of her home. So of course her metabolism will increases and body temperature will increases. So if her body temperature increases, is that it means she ovulates every day? No, it doesn't means like that. So it is very much basically used to tell that to measure the body temperature before waking up before waking up from the bed. Okay, so it is very important. So that is what we call as the basal body temperature. Okay, so advise her to take the temperature before waking from the bed. Okay, so why? Because it is very little bit temperature rising, only 0.5 to 0.8 degree Fahrenheit the temperature is rising here. Okay, if the temperature is rising in the presence of which hormone, is that estrogen or progesterone? Comment first. Yes, it is the P, that is the progesterone. Okay, so progesterone is there means body temperature is rising. Body temperature is rising means progesterone is there. Progesterone is there means yes, it is the progesterone comes after the ovulation. Is that correct? So means ovulation occurs. Whenever there is and the body temperature rises, so that is the not a safe period. Okay, so this is not safe period for the intercourse. Okay, so this is how our basal body temperature method works. If the female avoids the intercourse in this time, so she will not get pregnancy. Okay, so it's very basics. Okay, so hope the cervical mucus method and basal body temperature method is understand for you all. Yes, yes, this is not our question, here is our question. Yes, the basal body temperature methods, it is completely stands on the, yes, POP have given the correct answer. That is the daily measurement of the body temperature. It is very basically how to educate the female to, yes, before getting out from the bed, before getting out from bed. Okay, very simple and basic education you have to give to the female. It will ask in our question. Okay, so basic question. Here is the next question. Simple question again. So which method of natural family planning relies on the withdrawal of before ejaculation? Withdrawal before ejaculation? Yes, option A calendar method, option B coitus interruptus, option C symptothermal method, option D yes or cervical mucus method. As already told you that, so this symptothermal method is, it consists of the two things, that is the cervical mucus method and after that basal body temperature methods. So these two are the symptothermal method. So cervical mucus method we have discussed just now. Yes, the calendar method also we have discussed, also known as the rhythm method. It is only uh, helpful if the females what we call the menstrual cycle is regular. Otherwise, it will be not helpful. Okay. So yes. So this is the ovulation period, means 1 week before ovulation, 1 week after ovulation, not safe. So rest all the time. They can undergo for the sex. It is the very much safeful for the intercourse. Okay. So is that clear? That is the calendar method, also called as the rhythmic method. We have discussed. Yes, the coitus interruptus is the correct answer for this question. Withdrawal before the ejaculation. Yes. Is that clear? Yes, very nice of you all. Yes, here is the next question. Let's read the question. Which of the following is the common symptom of the bacterial vaginosis? Again, question from the bacterial vaginosis. Yes, itching, as I told, it is vaginosis. There is no itis. There is no itching. So option A eliminates here. Okay. Option B is the thick white discharge. Yes, sir. We have studied white discharge. I will keep this one greenish discharge. Students, greenish discharge I told. Greenish yellow discharge, that is the trichomonas vaginitis. Yes, this is clear. And painful urination may or may not be seen along with this one. So the classical one is the, yes, that is our thick white discharge is the correct answer for this question. Yes, remember for getting the good marks in the exam. Okay. Yes, is that clear? Yes, already discussed one, so that I directly came for the answer for this question. Okay. So here is the next question. Which of the following type of the vaginitis is commonly associated with the fishy order? Already explained one. So now I want answer from you all. Yes, just not to focus on what I have written, just focus on the options and give the answer. So which of the following vaginitis is commonly associated with the fishy order here? Option A is the bacterial vaginosis. Option B is the candidiasis. Option C is the trichomoniasis. Option D is the atrophic vaginitis. Yes, what is the answer? Shabash. That is the bacterial vaginosis. Already we have discussed while telling the bacterial vaginosis. Students, in the bacterial vaginosis, we are doing one test, that is what we call as the whip test. That is what we call as the whip test. What we will do in the whip test? We will take the 10% of the potassium hydroxide. Along with that, we will add the, yes, our vaginal discharge from the infected female vagina. Okay, this 10 percentage KOH plus vaginal discharge we will add, means it will give us the, yes, the fishy order, so that it stands for the whip test is positive. So I hope all of you are understand what is the whip test. Whip test is the just adding the 10% of the KOH to the vaginal discharge, it gives the fishy order. So that is what we call as the whip test. Whip test is done in the bacterial vaginosis. Okay, so yes, it is very important. And in the bacterial vaginosis case, so if we do the saline microscopy, what is saline microscopy? So just a second please. What is saline microscopy? Yes, saline microscopy is very much simple, students. Again, we will take the vaginal discharge from the infected female vagina. So then we will simply add a saline, okay, and we will keep under the microscope. In that one, we will get the clue cells. What is clue cells? Can anyone tell the clue cells and where the clue cells will be seen? Yes. So this is the epithelium. This orange color one is the epithelium, and inside the epithelial cells there is just the bacteria will be there. So that is the Gardnerella mobilincus bacteria inside the epithelial cells. So these cells we call this one as in the clue cells. So these clue cells will seen in the again bacterial vaginosis. Okay, so this is what we call as in the clue cells. It will be seen in the bacterial vaginosis. Hope the concept is clear. So in the saline microscopy, in the saline microscopy, clue cell will be seen in the bacterial vaginosis. Okay, so in the whip test, the fishy order will be there in the, yes, bacterial vaginosis. So bacterial vaginosis causative organism is the Gardnerella mobilincus. Is that clear? Clear, students. Yes, very nice of you all. Here is the next question. Read the question carefully. Hope the concept is clear for this one. Fishy order in seen in the which type of the vaginitis, that is in the bacterial vaginosis. Yes. Here is the next question. Read the question carefully, completely, then try to give the best answer for this question. Yes. Which of the following is not a recommended preventive measure for the vaginitis? Which of the following is not a recommended preventive measure for the vaginitis? Very basic question. So here in this question you will hear some new words, so that will definitely comes in your exams, okay, and helps you to solve the question. Yes. Option A is that wearing a breathable cotton underwears. Yes. So it will helps to prevent the vaginitis. Yes, because of that, this kind of the underwear may leads to the less sweat. Okay, so decreases the sweat or absorbs the sweat and reduces the yes wetness over the groin and genital area. So it may decreases the vaginitis. Okay, so then avoiding the dutching. So what is the dutching, students? Dutching is the yes, flushing the vagina with the water after intercourse. Students, it is not recommended to dutch the after intercourse. Students, some of the females, so immediately after having the intercourse, they will go to washroom and they will Dutch. What is the Dutch here? Dutch stands here that they will flush the vagina with the yes contaminated water. That may increases the yes bacterial vaginosis. So what other kind of the vaginitis also they can produce. So it is avoiding the Dutching is also very important. So it is basic education we have to give in the sex education to the adulthood. Okay. So urinating after intercourse, it will reduces the infections. But dutching after intercourse, it will increases the infection strains. That is very important to have to remember. Okay. So then using the scanted feminine hygiene products, students. So as I told that because of this scanted feminine hygiene products only, yes, the risk of the vaginitis increases. So this is the not recommended in the yes. All of you have given correct answer. That is the option C. This one only not recommended, that is the feminine hygiene products are not recommended nowadays. So okay, so it increases the vaginitis risk. Okay, so hope the concept is clear, and the good practicing the good practical so practicing the good hygiene is the very much necessary in order to prevent the infections. Hope the concept is clear. Yes, here is the next question. So what is the primary function of the barrier methods of the contraceptives? So barrier methods of the contraceptive, students. So yes, what are the things comes under the barrier methods of the contraceptives? Can anyone tell? I will ask the question. So you have to respond me in the form of the yes or no. Okay. So is that male condom is a part of the barrier method of the contraceptive? Say yes or no. Comment Y or N. Just comment Y or N. Okay. So is that male condom is a part of the barrier contraceptive? Shabash. Yes. Okay. Is that a FC2 is a part of the barrier contraceptive? What is FC2? That is the female condom 2. So is that a part of the barrier contraceptive? Shabash. That is also part of the barrier contraceptive. Is that a diaphragm is a part of the barrier contraceptive? Yes, it is also a part of the barrier contraceptive. Is that a today's sponge is a part of the barrier contraceptive? Today's sponge. Is that a today's sponge is a part of the barrier contraceptive? Yes, today's sponge also it is a part of the barrier contraceptive. So it is very important. Okay. Yes. Yes, these four. So condom, female condom, male condom, then diaphragm, then today's sponge. Among these four, which one is not included in the National Family Planning Program? I want the answer. So, which barrier contraceptive it is not included in the National Family Planning Program? Yes, very nice. That is the diaphragm is a diaphragm is a barrier contraceptive which is not included still in our uh, what we call the National Family Planning Program. So diaphragm is not included, but the today's sponge, female condom, male condom, all these three included. Okay. So what is the name of the male condom in the our National Family Planning Program? That is Nirod. What is that? Nirod. Okay. So the name of the condom in the National Family Planning Program is the Nirod. Okay. What is the name of the female condom in the National Family Planning Program? That is FC2, female condom hash 2. Okay, not hash 2 dash 2. Okay, so that is the FC2 is the FC2. What is this 2 here? 2 means, so the female condom is having the 2 rings, like male condom is having only 1 rings, like this. Okay, female condoms are having the 2 rings, so that is what we call FC2. Okay, so this is what we call as in the Nirod, and this is the FC2. Okay, so and yes, so there are these two are the very basically you have to understand. Okay, very nice. So my question is the what is the primary function of the barrier methods of the contraceptive? Option A is the suppresses the ovulation. No, students. So suppressing the ovulation is the work of the, yes, that is our oral contraceptive pills. Then as permanent method, that is the oophorectomy we can do. Okay, so option B is the physically blocks the sperm from the reaching the egg. Yes, yes, all of you have given the correct answer. That is the B. B is the correct answer. So it blocks physically by entering the sperm into the egg. It is very basically you have to understand that. So yes, if the consider this one as in the female genital tract. Okay, so these are the fallopian tube, and what is the site of the fertilization? That is the ample of the fallopian tube. So this way sperms will come is from here. The ova comes. Okay, so if the ova comes here from sperm comes, but the sperms remains inside the condom is, yes, it will blocks physically to enter into the enter near to the our ova. Okay, so this is how it works, very much basic, students. Okay, and so we can say this one as a it prevents the fertilization. Okay, so barrier methods of the contraceptives prevents the fertilizations by physically blocking the sperm by reaching the ova. Okay, so then alter the menstrual cycle. No, it is not part. Then changes the cervical mucus consistency is also not a part of the barrier methods of the contraceptive. Hope the concept is clear. So what are the questions we have discussed in the barrier method of the contraceptive? Four barrier method of the contraceptive, that is the today's point: female condom, male condom, diaphragm. So diaphragm is not included in the National Family Planning Program. Okay, and so these three are a part of the National Family Planning Program. Okay, so what is the name of the male condom in the National Family Planning Program? That is the Nirod, and female condom name in the National Family Planning Program, that is the FC2. Okay, so hope the concept is clear. And today's sponge is the, yes, this is also barrier method of the contraceptive, and this is having the one chemical. That chemical name is the, yes, nonoxynol 9. So that chemical is acts as a spermicidal. So whenever the sperm enters into the female vaginal cavity, it destroys the sperms. Okay, it kills the sperms. Okay, so the questions may ask like that also: which chemical which is present in the our what we call as the today's pond which kills the sperm cells, that is the nonoxynol 9 is the chemical that kills the sperm. Okay, so we'll discuss in the next question. Okay, so is that clear? Option B is the correct answer for this question. And here is the next question in front of you all: which material is commonly used to make the male condoms? Very basic question, students. So and updated questions, you have to consider this one. Okay, so in updated very back only. So but one of our famous nursing books, still it is like latex only. So if the question asked in the next days, don't mark as the answer as the latex. Okay, yes, I have eliminated the latex. Other options other than the latex, can anyone able to give? Yes, I know that in that book it is given as the latex, but now it is not making by the latex, because latex causing the some uh, a local irritation and the reactions. So latex they have stopped making the male condoms. Yes, it is the polyurethane. Okay, so polyurethane is we are using nowadays for the making the male condoms. Okay, so which material it is commonly using to make the male condom? Yes, male condom it is made up of the polyurethane. Hope the concept is clear. Yes, don't mark answer as a latex, as I am telling that. Very nice of you all. Okay, so here is the next question. Yes, what is the potential advantage of using the barrier methods of the contraceptive? Again, very basic questions and repeatedly asked questions. Is potential advantage of using the barrier method of the contraceptive, students? So we can say the potential means so extra. Okay, extra or other than the main important. We can say what is the other than the main important advantage of the barrier methods of the contraceptives? Other than the main, other than means so barrier methods of the contraceptives are mainly used for the contraceptions by physically blocking the sperm. So other than that, what is the extra benefits? Yes, they provided the protection against sexually transmitted diseases. Option A. Option B is the regulates the hormone. They requires for prescription. Yes, they are implanted under the skin. So it is very easy to eliminate. It will not be implanted under the skin. It is used on the skin. Okay, they doesn't require any kind of the prescription. So the Nirod box will be there in your PFC. Okay, you can directly insert hand in the Nirod box. You can take the Nirod without any prescription. You can take. Okay, so not a problem and not required for the prescription. Okay, so they are regulated hormones. No, it is not any related to the any kind of the hormones. Okay, the extra benefits, yes, all of you have given the correct answer. This protects the against the sexually transmitted infections. Yes, this provides the protection against the sexually transmitted infections. Okay, it is very basic conditions you have to understand. Okay, so next my question is this protect against the cervical cancer or not? Option A. Option A is yes, option B is no. I am asking the question, is that condoms are the barrier methods, or we can say the condoms? Directly I am asking the questions on the condoms. Is this protect against the cervical cancer or not? Yes, it protect against the cervical cancer. How? How means yes, as I told, that's the human papilloma virus. It is a sexually transmitted infection, viral infection. If it is protecting against this virus, means yes, of course, it will protect against the cervical cancer. Yes, many pelvic inflammatory diseases, many PIDs like gonorrhea, trichomonas vaginitis. Okay, so these all are transmitted by the sexual route only. So many PIDs are the sexual transmitted diseases, students. So if I am using the condoms, yes, the condom can protect against sexual transmitted diseases. Yes, the condom can protect against sexual transmitted diseases. Means condom should and must protect against the pelvic inflammatory diseases. And pelvic inflammatory diseases is the commonest cause for the yes the ectopic pregnancy. Okay, ectopic pregnancy. Yes. So the condom which is protecting against PID means it should protect against the ectopic pregnancy. In recent one medical exam, it came students. So condoms is effective against water and all except one. Okay. So except one is their other question, which is not related to the yesterday. Okay, so but it will protect against ectopic pregnancy also. It will protect against PID also. It protect against the yes our sexual transmitted disease also, and as well it protect against the cervical cancer also. Hope the concept is clear for this question. Yes, yes, very nice of you all. Yes, option. So the next question is the very simple and very important question. For how long can the today's sponge provide contraceptives protection after the insertion? So after insertion, so how we can insert the today's sponge? First, look at this uh, image. Okay, so this is our beautiful uterus, fallopian tube. Then here is the cervix. To the cervix, we are using one cap. This one. So this is what we call as in the today sponge. Okay, today's sponge we can use for the duration of the a day. Okay, we can use for the duration of the day. Day means 24 hours. Only one barrier method of the contraceptives we can use without changing for repeated sex. Okay. For example, you are using a condom. For after one episode of the intercourse, you have to discard this one and you have to use the another one. You are using the FC2, that is the female condom. So that one also after one intercourse you have to discard and you have to use another one. You are using the diaphragm. That is also you have to discard after the 6 hour after the use, and you have to use new one for the next intercourse. But the today's sponge you have to use for the multiple episode of the intercourse. Okay, so directly you have to discard this one after 24 hours. After 24 hours of the insertion. Okay, so this is how the today's sponge looks like. Okay, so this should be discarded after 24 hours of the insertion. Okay, it should be used for the duration of the one day. Okay, so is that clear? Yes, clear, students. So if you want to remove, you can use before, you can remove before that also, but maximum you can use up to the 24 hours. Okay, hope the concept is clear. Option D is the option B is the correct answer. That for 24 hours is the correct answer for this question. Yes, many of you have given the already correct answer. So now just identify this image. What is this image here? Yes, what is this calf? This is what? keep on telling that is the diaphragm. Okay, this is not included in this only, this diaphragm only, not included in our national family planning program. Okay, so this is how we have to insert the diaphragm. Okay, many very important questions they have asked from the diaphragm, that so minimum what duration we have to keep today diaphragm in the vaginal cavity after doing the sex. So minimum we have to keep this one for the 6 hours. What happens if we remove before 6 hours? So if we remove before 6 hours you are removing, means that failure of the contraceptives will happens. Okay, means the female will accidentally get pregnant. Okay, so if it keeps more than 24 hours, if it keeps more than 24 hours, sudden growth of the bacteria will be there. Sudden growth of the bacteria will be there. So sudden release of the bacterial toxin will be there. Okay, sudden release of the bacterial toxin will be there. So it causes the toxic shock syndrome. Yes, it causes the toxic shock syndrome. So yes, if you are using the diaphragm more than 24 hours, so it leads to the toxic shock syndrome. So the minimum we have to keep in the vagina is the, yes, that is 6 hours. If we remove before 6 hours, the accidental pregnancy will happen. If we keep more than 24 hours, it will lead to toxic shock syndrome. So there is then the, yes, the more loss than the benefit will be there here. More loss than the benefit will be there. So that is what the reason they have not added in the national family planning program. Okay, so hope the concept is clear on the diaphragm. Yes, is that clear, students? Yes, hope this one is the clear. So yes, hope that today's class is very much helpful for you. I will come with some more important questions on the family planning program in the next session. So 4 to 5 questions will be there. Okay, so after that we will go for the other topics of the OBG. Okay, so this is what, without family planning and the bacterial vaginosis and pelvic inflammatory diseases, there are rarest paper came in the nursing exams. Okay, these three concepts will repeatedly asked from the OBG. Okay, and many of your coaching faculty will neglect these topics. Okay, so but in recent, this is what striking repeatedly, so that is what I have focused repeatedly on these questions. Okay, hope the concept is clear for this today's session. Okay, again we will meet in the tomorrow session with the beautiful questions. Okay, so stay tuned with the master nursing classes. If you are not a part of my telegram group, you can join my telegram group. Here you will be getting the links for the classes, and so those very important questions that will comes in our exams, I am discussing in the telegram group also. Yes, so there are short quiz also available in my telegram group. You can, if you want, you can join my telegram group. The link is there in the description box only. Okay, so if the today's class is found helpful and the content is clear for you all, so yes, don't forget to write that the master nursing classes is the best for the RRB. Just you have to write, yes, master nursing classes is best for the RRB preparation. So yes, my preparations, your preparations will be, yes, always will be in the peak if it is joined with master nursing classes. Okay, so hope the concept of the today's session will be very much clear. If you have any doubt over this concept, you can do comment in the comment box. I will definitely come with that doubts in the tomorrow session. Okay, we'll meet in the tomorrow's class. Tab tak ke liye jai hind, jai bharat.